All right, so we're ready. All right. So, welcome back to another episode of Empowering Minds podcast. Today, we have a special guest joining us. We are thrilled to have Karese, a registered dental hygienist and a specialist in breathing and sleep. Karese is an expert in alternative health with a particular focus on myofunctional therapy. Her work is dedicated to helping individuals improve their overall health and well-being through better breathing and sleep practices. Karese brings a wealth of knowledge and experience to our discussion today, and I'm excited to dive into topics that are crucial for both dental health and overall wellness. So thank you so much for joining in today.
Thank you for having me. I'm so happy to be here.
Good. Thank you for accepting the invite. All right, so we're just going to jump right into some questions. Question one. What is the truth behind the tongue-tied fad?
Ooh, so you'll hear a lot of things going on nowadays where some people are all into tongue ties and they'll say everything looks like a tongue tie. And then you'll hear the opposite perspective where some people will say it's not even a thing. And so in the medical world, there's this clash of minds where honestly, a lot of medical professionals, if you didn't learn it in medical school or dental school, it's like it doesn't even exist, right?
Mhm,
And a
mhm,
lot of tongue ties is not taught. Honestly, 0% of it is taught in a lot of medical schools. There are some professionals who will get training afterwards, oral
mhm,
surgeons and ear, nose, throat doctors or otolaryngologists. It's such a big word. They get training on it. But in general medical school, they don't get any. And similarly in dentistry, they really don't get any. So it's not a fad. It's something where as we evolve as people, we wind
mhm,
up learning more and we learn about how the tongue is such a vital organ because that's what the tongue
mhm,
is. It's got its own secretions, it's got its own muscles and skills that it can do. It is its own essential organ that we really need for breathing, chewing, swallowing. And when there's a restriction, which would be a tongue tie,
mhm.
when there's a restriction, that's going to prohibit us from having some vital functions. And so making sure that you identify the people who have sought out additional information, because there's a lot out there. I mean, with the boom in industrialization, with the boom in technology, there's so many new things we're learning. And so when you are seeking out to understand whether or not you have a tongue tie, it's incredibly important to speak to somebody who you know has gotten ample continuing education on the topic because it's
Mhm.
not something that they're taught. I don't care what school they go to, Harvard, Yale, Princeton, it's not taught.
Okay. Thank you for that. And I've been like doing some reading and research ever since I reached out to you because I remember early elementary school, I think I was in maybe first or second grade, and I want to say first grade, and one of my friends had a tongue tie. I remember her mother telling me that, but I didn't know what it meant. I just knew her tongue, it was different. It was different from mine, but I didn't know what that meant. So this has been very educational for me because I do remember her having a surgery as we got older, maybe fourth or fifth grade, but I just didn't know what it meant. So I
Oh,
thought it was like, I was just, I guess I just thought at that age it was like a form of a birth defect and our tongues was just different. And that's all I knew. So this has been very educational, a learning experience for me actually. So again, thank you for coming.
yeah.
All right. So the next question, what should a new mom do if her baby has a tongue tie?
If your baby has a tongue tie, don't panic. So, one of the biggest things that we see and the most common misconception is that tongue tie is related to absolutely everything that's wrong with breastfeeding or the breastfeeding relationship. And that's just not
Yeah.
true. Function is something that has to be learned on both ends. It's the mom who has to learn how to really establish that latch and the hold in order to facilitate a really good latch. And it's the
Mhm,
baby that has to coordinate how they're going to grab on and compress and to acquire the liquid gold from the
mhm,
breast tissue, right? So function is a big part of it. You might have a tongue tie. You'll probably hear from lots of people who say, oh, my kid breastfed just fine. I don't think they have a tongue tie. But they were very functional babies. All
Mm-hmm.
tongue ties don't result in us having a need for surgical revision. That way you can establish that breastfeeding relationship. So the very first thing that any new mom should do, if you think your baby, you suspect they have a tongue tie, you
Mm-hmm.
need to see a functional provider. So you need to see a lactation consultant, a feeding therapist, a myofunctional therapist. That way they can give you the guidance so that you can establish that functional relationship first. Now, if that's failing and we can't establish function, well, now we know for sure the baby needs to have a revision done in a surgical procedure.
Mm-hmm.
If you're working with a functional provider, likely on their team, they will have a referral network of highly recommended providers who they've worked with, who they know are really good at these procedures and will get you an adequate release. That's going to be who they send you to. So you don't have to do any guesswork. You don't have to just pop into an office somewhere and say, hey, my baby has a tongue tie, and then they release this tissue. And now you're all confused because you don't know what you have to do for all of the healing to go optimally, because
Mm-hmm.
the process. If you start with function, you'll end out with better outcomes. So go to a functional provider as your very first step.
Gotcha. Okay. See, I didn't realize that a tongue tie can impact the baby's sleep pattern and lead or possibly lead to developmental issues. And then I guess the disruption of the airway makes it harder for a baby to sleep, which I'm guessing could cause a little stress for the baby as well.
Absolutely. So
Hmm.
it's really multifactorial. The tongue tie is one aspect of it, but
Hmm.
then the whole trauma of birth in and of itself. Birth is a traumatic event, and depending on
Hmm.
how birth occurs, sometimes it's assisted with vacuum, forceps, cesarean section.
Hmm.
There's these pulls, these strains, these tensions that are created, and that also impacts the whole system, right? So it's that combined with the dysfunction, often resulted by the tongue tie, so the dysfunction, and then the structural trauma. It's those two things that together, it's how those two things are manifesting in the baby. So you might see colic, you might see feeding issues, you might see acid reflux, you might
Okay.
see sleeping issues, you might see torticollis, you might see plagiocephaly. There's a whole wealth of things that you could see that
Hmm.
manifest in the baby as a result of the way these two, dysfunction and structural trauma, combine.
Okay. So I want to lead into that. What are some implications of not treating a tongue tie?
So when you don't treat a tongue tie, a lot of times function does not self-resolve. So what
Mm.
happens is that baby gets older and starts doing more complex tasks. Some of those tasks are motor skills, being able to
Mm.
crawl, walk, run, jump, skip, hop. And certain aspects of that might be affected, like the baby's gait or posture might be affected as they get older.
Okay.
Yeah, and then later on, they may develop other issues. There's been some links with scoliosis and, Dowager's hump. And so the effect of not treating it could potentially lead down a trail of where it gets worse and worse and worse for their posture or their motor skills. You could have issues with speech.
Hmm.
Oftentimes, it's very difficult to tell when they're very young because speech errors are to be expected in ages 2, 3, 4. We anticipate that's going to happen. They're still kind of putting together their words. There's a reason why we haven't started like mainstream schooling yet. It's kindergarten at age 5. At 5 is when you want to see that, yes, okay, all of those words sound very clear, they are well articulate, and we can hear that and go. But let's say we get past that area and we're looking now at their speech. Well, you could be seeing their tongue thrusting forward when they're trying to produce certain sounds.
Hmm.
So typical sounds where you might see that might be the L, the T, the N, and the D sounds. And then you might hear errors in their S's, or perhaps they have difficulties with their R's or their CH's. These are issues that can eventually continue on. There's been some research linking with Tourette's, linking with stuttering. And so these are
Hmm.
issues that might come along too. Now, I don't want to scare anybody by giving all these possibilities, but all of these are things that could potentially manifest. So it's
Mhm.
not to say you'll get everything wrong, but you could have one or two things. You could have 3 to 5. Sleep issues are also another one. The sleep will only get worse. It
Mhm.
only compounds. That's it. So if you have a toddler who's not sleeping well, that is going to be an elementary school kid that sleeps poorly. That's going to be a middle
Mm.
school kid that is disruptive and has difficulty in school and education wise. That's when you really start to see it. That's when you're going to have your high schooler that is a bit more rebellious, that they're getting the least amount of sleep and they really need the most during that time frame. And so as they get older, all that lack of sleep can affect their growth, their learning and cognitive abilities, their mental health, a lot of
Mhm.
associations with depression and anxiety, and how it manifests as a result of sleep deprivation, in addition
Mhm.
to lack of focus and hyperactivity for a lot of children. So it gets worse on almost all levels and scales, the digestive system, the endocrine system, like everything. There's so many connections.
Oh, wow. Okay. Yeah, I'm listening to you, and I also read in this article where it said the tongue is a small, powerful organ, but it is often overlooked. And so if you can kind of tell us about why the tongue is so important in our health.
Absolutely. So our tongue is critical for breathing as one of
Mhm.
the primary roles that it plays in. And we know breathing is essential. So we can go for weeks without food, we can go for days without water, but I don't know how many of us are going to go for any more than a few minutes without oxygen. We need to
Right.
breathe, right?
Uh-huh.
Respiration is key. Our tongue plays a role in that because at rest, so when you're not doing anything at all with your mouth, your tongue should be sitting lightly suctioned up against the palate, the roof of your mouth. So when it's sitting up there in its totality, we want as much of the body of the tongue up against that palate as possible. So from just behind your upper front teeth all the way back to that soft palate, you should feel your tongue engaged with your palate lightly. That's going to stimulate the nasal floor. Now that's
Mm.
going to help you with respiration. And that's where we want respiration to occur. When our tongue is stimulating that nasal floor, now we're able to filter out and to we're filtering out and humidifying the air, and we are producing nitric oxide, which is going to help it bind to those blood receptors. And so we'll be able to facilitate the movement of that oxygen throughout our body better. It is the only way that we want to be breathing. So not only does the tongue stimulate the nasal floor, the tongue actually also communicates with our cranial nerves. Most importantly, our vagus nerve, when it is in contact with the palate. The posterior or the back of the tongue communicates with the vagus nerve, and that's actually how we regulate our autonomic nervous system. So a lot of people might know it as parasympathetic or sympathetic, or in rest and digest, fight or flight, that type of system.
Mhm.
Body can either be really hardwired for stress, or it can be relaxed and you're able to do productive tasks like digest, sleep, reproduce, effectively regulate your hormones. So our tongue is a vital player in our cognitive and mental health, in being able to just sit against the roof of our mouth, and our respiratory health by being able to facilitate and stimulate that, in addition to being a key player in the role of sleep. Because again, breathing is primary, and our
Mhm.
body has a lot of restorative tasks that it does in our sleep. Our brain detoxes during our sleep. We get our memories input during our sleep,
Mhm.
cell rejuvenation, our immune system kind of re-ups itself while we are sleeping. A lot is happening while we're sleeping. However, if you're snoring, or if your
Mm.
tongue falls back into your airway, or if you are struggling with obstructive sleep apnea and you stop breathing and you're gasping multiple times in the middle of the night,
Mhm.
guess what your body is now prioritizing? Keeping you alive. It's prioritizing respiration, right? Because we need to breathe. So our tongue, more often than not, when you hear people snoring or they're sleeping with an open mouth, a lot of times that tongue has fallen down and back into that airway, and
Mhm.
that's prohibiting them from getting adequate oxygen and thereby prohibiting a lot of restorative tasks that we need to have done.
Okay. So you've mentioned sleep several times, and
Yeah.
then you hit something that resonates with me with snoring. And so I know that that does impact my health and productivity because I used to wake up with the worst headaches. I guess my brain was just trying to fight, trying to breathe, and I would always wake up with these headaches. So how does poor sleep, how does that impact our health and productivity as well?
Ooh, poor sleep is going to be the biggest factor in your ability to be productive. So the
Mm-hmm.
quality of your day to day is 100% dependent on the quality of your sleep last night. So if you
Yeah.
didn't have a great night of sleep last night, today's probably not going to be your best, most clear day. When
Mm-hmm.
we have a brain that is not getting adequate sleep, it's not able to fully drain. You don't get to, empty out all of the things that you've learned and put them into the deeper parts of your memory
Mm-hmm.
and keep that in a memory bank locked up somewhere so that you can intake new information. And then you just put some coffee in your body, trying to hope that it keeps you up.
Yeah.
What's going to happen is that your brain is actually acting more as if you were inebriated than if you were clear of mind. So we find that with a lot of the research, people who are intoxicated or inebriated, how they are lacking coordination, decision making skills,
Mm-hmm.
cognitive reasoning. A lot of that happens when you don't get good sleep, too. It mimics that.
Mm-hmm.
So, without ever actually taking a sip of anything or having any kind of, alcohol or any sort of intoxicating thing, you can mimic that in just getting one night of poor sleep. So now multiply that over multiple nights, and you'll 100% understand why your productivity won't be at all what you want it to be if you have not established a good sleep pattern.
I'm glad you said that because I haven't always had the best sleep hygiene, and it did impact me cognitively, especially with like my attention and focus. And so over time, I started to experience a lot of like brain fog. So now I'm more intentional about my rest and sleep. There's at certain times, I'm putting a timer on my TV. I'm putting all electronics away because that was impacting me too. For whatever reason, I used to think I need my TV on so that I can go to sleep, not realizing that my brain was still getting that activity. So my brain was not resting. And I did that for a long time, and it really impacted me. I mean, I had to end up going to a neurologist.
Mhm.
Yeah. So yeah, so proper hygiene, that's very important for me now. Yeah.
Absolutely. I
Yeah.
love.
Yeah. All right. So you talked a little bit too about sleep apnea. So what is myofunctional therapy and how does it help and how can it help people off of their CPAP machine?
So myofunctional therapy is a exercise-based modality. I like to compare myofunctional therapy to personal training. I'm like a personal trainer, but for all the muscles below the eyes, but above the shoulders. So I work with all the wonderful muscles in that range. There's over 100 of them to help strengthen and coordinate them. That way we can eliminate any dysfunction. When it comes to sleep apnea, we're going to go right back to that personal training example. So let's imagine we have somebody who has six pack abs, and we take that person and we lie them down in a bed. Gravity is going to play a role in us lying down, right?
Mm-hmm.
So we're going to lie them down for bed. Those six pack abs are not going anywhere. Like,
Right.
I don't know if you know anybody with six pack abs, but when they lie down, those abs are
They're
right there,
there. Yeah.
still prominent. Okay. I think we all know somebody that has the opposite of that, like a beer belly type, right?
Right.
When you lie somebody down that has a beer belly, it doesn't sit up in that same way.
Nope.
Gravity has an impact on all the loose musculature there and is able to kind of shift things, right?
Mm-hmm.
So let's compare that to our airway. When we lie down, very first thing we have that impacts us, gravity. Gravity is now exerting an undue force, which when we're awake, you're able to combat that. You can breathe fine. But the first stages of sleep are muscle relaxation. So all the muscles start to relax. Now imagine if your airway is not quite strong and, the muscles aren't as toned as they should be. Well, all of that is gonna kind of fall in on itself, and it will collapse, and then that makes you
Mhm.
susceptible to obstructive sleep apnea. What a CPAP does, it's a continuous positive airway pressure machine. So it's continuously pushing positive air into your upper respiratory tract to forcibly hold apart those muscles that would otherwise collapse. So what they're doing there is just holding open the airway. But what if you had like six pack abs or muscles that were really well strengthened and
Mhm.
defined? You would be able to facilitate, like the man with six pack abs, everything staying exactly where it stays, even though we all have gravity that
Mhm.
that additional force on us. So that's where myofunctional therapy comes into play. It's like having a personal trainer for all those muscles, because we don't think about any of these muscles above the shoulders, right?
No. Mm-mm.
We have gyms everywhere, all across America, personal trainers that are working on every muscle below your neck that you
Right.
can think of, right? You have leg day, arm day, shoulder, back,
Yeah.
all those things, right? But these are the muscles that really help to keep you alive. This is where food is entering. This is where oxygen is entering. This is where we digest. This is our mental capacity. All of this really has to be taken care of too. So I'm like the personal trainer who helps to address all the muscles that are going on in the vital space below your eyes, but above your shoulders.
Gotcha. Okay. Well, again, I want to thank you for coming on the podcast today and sharing your insight on myofunctional therapy and how it can enhance sleep quality, support dental health, improve speech, and contribute to basically our overall well-being in children and adults. So, I didn't know if you had any final thoughts. Do you have any books or anything that you have written or anything like that that you want to talk about or share?
I do. So I want to share two things. So one,
Okay.
one of my final thoughts is always that I think people should advocate for themselves. Oftentimes with the traditional medical model or the traditional dental model, we just go in and whatever we are told, we're told. And if you don't believe it, you're just like, okay, well, you just kind of let it go. But
Mm-hmm.
if you feel like something's wrong and you're not getting the attention or the right answer that you would like, or you're not getting a root cause solution that you would like, advocate for yourself. There are providers out there who will take into account how you feel and how you think. That way you can be a role in your own healthcare. And so
Mm-hmm.
advocate. I always like to mention that. Then I have a book. It's called Accomplished: How to Sleep Better, Eliminate Burnout, and Execute Goals. This is available on Amazon. Accomplished is a fantastic read that is not heavily long. It's like a less than 150 pages.
Okay.
But in all of that, I'm really diving deep and getting straight to the point, because I hate fluff, I hate filler. We didn't need 300 pages. We just need 150 about to get to the point on how you can improve your sleep and increase your productivity.
Okay.
Wonderful.
All right. So if you don't mind, I'm going to go on Amazon, find the link. I'm going to put it in comments in case people want to check the book out, and they can go from there. And I'll be sending you the YouTube information to a little bit later this afternoon.
Okay.
Okay. Thank you so much. I enjoyed this podcast conversation with you today.
Thank you
All
for
right.
having me.
Yes, ma'am. Thank you. Take care. Bye.